Dr. Scott, I've noticed patients coming into our office who have been to see other chiropractors and have been committed to care plans and had to pay a lot of money up front, and so are a little hesitant to commit to another program and pay more money. How do you deal with those?
I have definitely seen that several times in the office, and I think hopefully through the educational process in the office on the day one, on the day two, those issues are handled as a patient begins to really understand the difference between their structure and their function, and really that the structure is supported by soft tissue and understanding soft tissue healing. In the process, in the report of findings, we're really establishing timeline patterns and managing a patient's expectations. Unfortunately, when we just manipulate the spine, it's a powerful thing, and a lot of chiropractors just manipulate, but where they fail is they fail to treat the soft tissue. And as a result, I think they fail to manage the patient's expectations. They don't stop and reevaluate. They don't really, even in a lot of cases, I've seen plans where they haven't even started with an x-ray. And so I think managing patients' expectations is a critical thing right from the beginning, and establishing soft tissue healing. And when they understand those principles, I think it makes a lot more sense to them. So when they ask me that question, one of the first things I like to ask them is I turn to them and ask them the question, based upon the understanding of soft tissues and ligament healing and understanding that process there, do you feel that this is something that will correct or address your condition and take care of and solve the problem that you have? And also, as you learn to maintain this after care with home exercises, can you see the value in what we're presenting compared to the other plans that you've had? In most cases, they understand that and are ready to move forward. If we're dealing with a spouse, it's absolutely critical that that spouse has at one point had an office tour, that they can see that what we do is very, very different. And then also seeing some pre and post x-rays are very, very important. I think another way to manage their expectations is really through the examination process and making sure that they understand that this may be a 3-month plan, or it may be a 4-month plan, whatever the length of that corrective care plan is, that they understand that there's going to be a stop, a control there put in place where we can actually reevaluate their structure and function and be able to quantify the results and give them a report based upon that compared to the first one, and be able to say to them, at this point, after 4 weeks of care, you have improved 25%. Now that's exactly where we expect you. If they were below that, we've got to stop and figure out why. Now, some of the reasons could be why. It could be that they have, we need to gather some more information, like an MRI. We may need to refer them up for a second opinion. In some cases, we have no control over what the patient is doing. Are they doing their home care? And their results may be behind because they're not. And they need to be, in a sense, disciplined. I guess the policies that we set in the beginning need to be reviewed with them. So they need to understand those parameters, and they need to accept the responsibility in the plan to get the results that they're after, and understand that we're going to stop, reevaluate, and review with them. So those are the key things I think can help them get past those barriers.